And I'm out here in the newsroom as well. It is October, and October is Breast Cancer Awareness Month. And so we want to talk about your breast health, so important this month. Dr. Stuart Kaplan is joining us from Mount Sinai's Comprehensive Cancer Center. Nice to have you again with us.
Thank you. Nice to be here.
So tell me again a little more about the importance of breast cancer screening. There's both the high-risk group as well as just the general population. What's the difference?
Well, for the general population, again, annual screening, so once a year screening, should begin at age 40 and should continue every year for the remainder of that woman's life, again, unless there's something that precludes that health-wise. For the high-risk population, things are a little bit different. First of all, there are some other modalities that we can use in addition to mammography for high-risk women, and even in some cases for women that aren't at necessarily high risk, but if they have what's called dense tissue on their mammogram. So the first would be ultrasound, which we use routinely at Mount Sinai for screening in addition to mammography as a supplement, not instead of, but as a supplement. And again, we're able to detect some breast cancers that way that otherwise would go undetected for a year or more probably. MRI is also something that is becoming quite useful in the screening modality, and we use that mainly in high-risk women or in women that have been diagnosed already with breast cancer, but we look for other areas that may not show up again with mammography or even with ultrasound. So there are a lot of things we can use in our armamentarium to fight breast cancer.
That's a good word. Okay, I'm going to remember that word and use it on an SAT test. Also, there's the BRCA. I know that I actually had that test done because I have two cousins and an aunt that were all diagnosed in their 40s with breast cancer, and that's an important thing for some women who are very high risk to perhaps look into their genetics as well.
Yeah, again, there are some factors that would lead one to have the BRCA testing. Certainly if you have significant family history, usually it's two or more first-degree relatives with breast cancer that would lead someone to have the BRCA testing. So it's not for everybody, but once the BRCA testing is done, again, if the woman is positive for the BRCA gene, and there's BRCA1 and BRCA2, then they may go through some additional testing like MRI or ultrasound, and some opt for either some other treatment options as well.
And what kind of questions have you been getting from some of our viewers this morning?
One related to hormone use and risk of breast cancer if you have a high risk and you're taking things that, actually this was more of a supplement, over-the-counter type supplement question.
And that is sort of a good question in terms of a lot of women are told that not to have hormone replacement therapy because that could actually cause breast cancer or precipitate it. So tell me about that.
Right. Well, it's never really been proven one way or the other specifically whether hormones cause breast cancer, but there's been a lot of studies looking into that, and certainly there is evidence that women that have developed breast cancer, if they're on hormones, the cancers can grow faster, more rapidly. So usually women are taken off hormones in that setting. But again, it's always wise to just consult your doctor and go through the reasons you might need or want hormones and whether or not it's appropriate in your individual case. All
right, well, I'm going to let you get right back to our web chat. Thank you so much for being here. Dr. Stuart Kaplan again from Mount Sinai's Comprehensive Cancer Center is here for our Monday morning house call, and he's answering all your questions till 10 o'clock today. Again, this is Breast Cancer Awareness Month, October, and so important to take that time to take care of yourself, all of us as women, and remind your sisters and your friends to do the same thing.
Such good reminders, Christy. We need to be aware of that. Thank you. We'll stay on the